What to expect when getting immediate dentures? What is normal? Let's go through some of those things. So, when you get immediate dentures, it is getting dentures put in at the same time that you have your teeth pulled. They pull the teeth out and they put the denture right in your mouth. Okay, so you're going to have, blood clots in the little sockets that are forming. You're going to be bleeding, and at first, you're not going to feel anything because your mouth is going to be numb. But as the days go on, it's going to be a roller coaster. So during the first 72 hours, you're going to have swelling, and that denture is going to be loose to begin with because we have to, take off these little edges that are tight so that they won't scrape over the sides of your gums when they're going in and coming out. And that really makes a little bit of room for swelling as well. So the things that I want to go through, though, are more of the things that concern people, okay? There are things that happen during the immediate process that I get a lot of messages on, and, concern from my patients, at times, even though, I try to tell everybody very transparently what to expect when going through this. It's a scary process and it is unnerving, okay? So facial fullness is the first thing, and facial fullness is because these have to be built over your existing gums. These, acrylic areas, these phalanges, these have to go over where your gums are, right when you have the teeth pulled out. So there has to be some thickness of acrylic to be secure and to hold this teeth in the denture. So, it can't be paper thin because it wouldn't hold its structure. So you're going to have some thickness of that acrylic that's going to be in your mouth between your gums and your lip and your cheeks, and it feels like you have a huge hockey puck in your mouth. It is very distressing to the patient a lot of times because they feel like they have a monkey mouth. They say they feel like they're pooching out here, so or bunny teeth. So that is a very common thing to go through in the beginning. As your gums shrink, the denture kind of moves back into that space as the swelling goes down and the gums recede. So that typically goes away. And, later on when they do a reline, they can go and thin this out so that it's not sticking out and displacing your lip. Excess salivation is another thing. So when you first get dentures, you're going to have excess salivation because your body thinks that there's something to digest. That's the first step in digestion is salivation. So that is a very common thing too, and that usually calms down within a couple of weeks, but in some patients it takes longer because everybody's body is different. Your saliva production could be different than somebody else's, and just the fact of having that appliance in your mouth, especially when it gets loose, can stimulate your body to start producing more saliva. Gagging. Gagging is a big one. It's no fun to have this on the roof of your mouth, and it's going to take your body a while to get used to the fact that there is something covering the roof of the mouth. Your tongue is going to be really upset about there being anything in your mouth at first, and it's going to have to get used to that. And your tongue is used to, extending all the way to the roof of your mouth, and now there's something stopping it, and so it has to develop muscle memory to not, be going up so far. I go into more detail on things that can be done to decrease gagging, which is reducing the back edge of this denture and thinning out the palate. I would not suggest taking out the entire palate because then you won't get any suction. That's a whole nother video. Sore mouth. You're going to have a very sore mouth because you've just had trauma done, obviously, but also as you shrink and heal, the denture can start really rubbing on areas that are prominent. These are very common areas for sore spots right here above the canines, because the canines are kind of the corner. You've got the front and the back, and this is kind of where it makes a corner. So there's a lot of bone right here. And as that denture loosens, it can kind of hang and catch on these areas right here. The roof of the mouth will start to get sore as that denture shrinks because the roof of the mouth doesn't change. So that starts to ride pretty heavily on the roof of the mouth. Getting a soft reline, which is a temporary reline material that goes in there like an impression and it stays in the denture, that helps to stabilize this denture and take up for where your gums have shrunk. The sides of the gums. This is a big one that I think a lot of people don't realize what's really happening is the sides of the dentures, the lowers and the uppers, but see on the sides of these phalanges right here, as the ridge shrinks, the ridge is the top of the crest where your teeth used to be. That's the part that is rapidly shrinking and going down. So as that goes down, that denture starts to move down into that space that's created, and those edges start, really digging in all the way around. Something that I do when I make immediate dentures is I try to really be mindful and predictive of that when I'm making immediate dentures, and make these a little bit shorter than they need to be, because we're going to reline them anyways, and I'm going to lengthen those up later on. But while the patient's healing, it's nice to just kind of make them a tiny bit shorter so that they don't move down and make the patient so uncomfortable. Looseness, dentures are going to be loose when you first get them, immediate dentures, because of, what I've talked about with those edges. We have to open up these edges so that they don't scrape against your bones that are still very bulbous and sticking out. What else here? Okay, this is a big one too. When you get immediate dentures, because of the swelling and because of the differences in anatomy from one side of the mouth to the other, the dentures can sometimes at first be sitting a little unevenly, and that usually corrects itself as the swelling goes down and the gums start to recede. Let me just give you this scenario. Let's say I have a patient who has already lost all of these teeth on one side in the back, and so these gums have already shrunk and, receded over here, but they still have all these teeth over here. So they get these pulled and the front's pulled, and this is already healed. Well, this side's not going to be doing anything. It's already stable. But this side has, extractions, fresh extractions and fresh extractions here. So this side's going to swell, and that tissue is going to push that denture down a bit and kind of tilt it in the mouth, when that is swelling. So as that swelling goes down, that tilt will usually right itself, and it'll come back up where it's supposed to be. Same exact thing with the lower, depending upon where, the teeth are pulled, that denture could be caused by swelling to tilt up, tilt forward, tilt back. There's all different types of scenarios, but I hope that makes a little bit more sense of why things can be a little bit uneven during that healing process. Bleeding is totally normal. I have a lot of messages on here when people are saying, it's day 3 and, I'm really concerned because I'm still bleeding. That is totally normal. Everybody is different. Wounds in every single person are going to heal at a different rate. It's usually swelling is on the uptick for the first 72 hours, and then it starts to subside and go down. And that's kind of with bleeding. It usually is, kind of on the uptick for the first 72 hours and then starts to go, down. It just really depends upon your body chemistry and your clotting time. One of the things I'd really like to stress is make sure that when you are selecting your provider, or if it's selected for you from your, insurance, talk to them and ask them in the very beginning, what is your access to getting adjustments for your dentures? Because I think it's really important in the immediate denture process to have quick access to your dental provider. And by quick, I mean, no more than a couple of days. In my practice, I'm a small practice. It's just my husband and I, and we're in a town of about 12,000 people, so it's not too big here. But I have a busy practice, and I always try to put my patients in the day that they call me when they have a sore spot going through, well, any denture process, but especially the immediate denture process. Things are happening so fast, the gums are changing so quickly, and it's such a difficult time for the patient anyways. I don't want them to suffer, I think it's really important to talk to your provider about that and make sure that you have good access to your provider, because during the immediate process, you're going to need it. So I hope I've covered some good things in here, and if you have any questions, then drop them in the comments. All right, guys, have a good day. Bye-bye.